Dr. Paul Jung, Rear Admiral Paul Jung. We appreciate you being here, sir. And I want to begin by mentioning that I believe it's been about 5 years since the Surgeon General's call to action to control hypertension was released. So, from your unique vantage point, how do you think the nation has responded to the Surgeon General's call to action?
Well, thank you, John. It's great to be here with you and the National Forum this afternoon. I really appreciate this opportunity. Yes, the Surgeon General's call to action to control hypertension was released about 5 years ago, and it was a great way to put a mile marker down and let the public know where we stood as a nation with regards to hypertension. But with regards to how the nation has responded, I have to say, but let me qualify my remarks. So the data from the National Center for Health Statistics shows that between 2017 and 2023, there was no significant change in the three domains of hypertension, that is, awareness of hypertension, hypertension treatment, and hypertension control. And that may sound disheartening, but we have to qualify this with the fact that around the same time, we entered the COVID-19 pandemic, and that threw everything into a tailspin. And so there were bigger things that were front of mind for most Americans for those years. And so I would have to say it's probably understandable that hypertension may have taken a back seat, although not something we want to happen, but just as an explanation of where we might stand. On the other hand, those three domains, they didn't go down. We didn't reduce awareness or control. On the other hand, we also know that the death rate from COVID-19 was approximately 1% worldwide, but 1 in every 5 COVID deaths was someone with a history of hypertension. So we can't ignore the relationship between something like COVID and chronic disease. So now that the pandemic is behind us, there's an opportunity for us to refocus our energies on chronic conditions like hypertension that significantly affect our health.
Great. And that's very helpful context. Thank you. And yeah, I think we can take steady as she goes as a plus because we saw that there were other um, health factors that moved dramatically during the pandemic, some plummeting, some spiking. So that could be a positive. Where where have you seen other indicators of progress, and where do you think we have the most work still to do?
Sure. Well, the fact that we had a Surgeon General's call to action on this topic, I think, is a big deal. Personal bias aside, the Surgeon General is the nation's doctor, and having their stamp of approval on an issue like addressing hypertension is a big step towards making hypertension control a national priority. But we clearly still have work to do. Obviously, we need to focus on those issues of awareness, treatment, and control. And I think the Surgeon General's call to action, even though it's 5 years old, still stands as an excellent blueprint for the work that we need to do. Specifically for me, I think the key in the report is where it discusses the need to have partnerships with communities, with organizations, payers, innovators to engage in hypertension control. In other words, it's not just the patient and the doctor in a clinical interaction. It's everybody that needs to chip in to address this issue. And I think that's where the money is.
Yeah, thanks. And that's a great way to tee up our upcoming conversation with Mayor Booker.
Yes.
Um, Paul, you and I talked in the green room a bit about the KFF poll that was released this week, in which 61% of American voters say the cost of health care will have a quote major impact on their midterm vote. And that includes 56% of those identifying as MAHA. How can hypertension prevention and control serve as a path to healthcare cost containment?
Yes, absolutely. So affordability, obviously, is a huge issue right now. And as you mentioned, pocketbook issues play out in the voting booth. The call to action from the Surgeon General specifically calls out cost as one of the issues to consider with uncontrolled hypertension. The quote is something along the lines of, we need to recognize the substantial economic cost for uncontrolled hypertension. Now, at the time when I read that, I thought it was all about private companies trying to reduce the cost of their healthcare premiums for their workers. But as we all learned in Economics 101, everything's related. It's all connected. And so it's not just about the high cost of healthcare insurance, but it's $10.3 billion per year from absenteeism from work for any company. It's $2,500 per year per person spent on health services related to uncontrolled hypertension. That's a lot of money coming out of your pockets, coming out of the pockets of your companies that you're working for. And in times like these, every penny counts. So it's obvious that chronic conditions like hypertension can really lead to explosive costs, and that's going to have a negative effect on people's economic situations.
So, if I'm hearing you correctly, Dr. Jung, you're saying that uncontrolled hypertension and the different conditions that it leads to, the different chronic conditions, has the effect of being like a hidden tax on everybody. Is that accurate? Is that an okay summation of what you said?
If that gets more people to pay attention, then I'm all for it.
All right. Well, with the things that have been discussed so far in this convening and what you've seen, the data you gave from NCHS and other sources related to our nation's response to the Surgeon General's call to action, when we think about bringing hypertension under control and increasing the urgency to do so, where do you see the biggest opportunities over the next 2 to 3 years?
Yeah. Well, I think the earlier sessions at this convening, I think, brought up some of those big topics. Session one was about innovation. Session two was about leveraging teams. If we think about innovation, one idea that I think will take hold is the new Medicare access model from CMS. Access is an acronym, and it stands for Advancing Chronic Care with Effective Scalable Solutions. And it's a 10-year pilot program that's going to start this July with Original Medicare. There was a discussion a little bit earlier about how Medicare doesn't cover the cost of home blood pressure monitoring devices. The Access program may provide a way to do that through technology-supported care. So the way Access will work is it's a new payment mechanism that pays the provider based on your control of hypertension. That means that the clinicians will be incentivized to help you use, for example, a home blood pressure monitoring cuff, keep your hypertension under control for longer periods of time. And they could do that maybe with a third-party organization that could send you a blood pressure monitoring cuff, maybe download an app on your phone that collects the data from the blood pressure cuff, also tracking your physical activity, maybe the foods that you eat, and whether you forgot to take your meds for the last couple of days, all of that into a model that can provide a much bigger picture of the context of your hypertension. And with that information, the patient and the provider can work together to figure out ways to control their high blood pressure. So again, not a direct payment from Medicare to pay for the blood pressure cuff, but a system and a model that would incentivize utilizing and paying for those home blood pressure cuffs to reduce the hypertension. And then secondly, with regards to leveraging teams, again, I think the biggest point we need to emphasize is that hypertension control is not just a matter of a patient and their doctor. It's pharmacists, I think was mentioned, the entire care team, but also communities, just like with the mayors, payers, innovators, everybody. We all need to be all in on this.
Yeah, there are a lot of recurring themes here.
Yeah, it's good.
Yes. Dr. Jung, we framed this session, this conversation that we're having, for those who checked the program book, we framed it as hypertension control to make America healthy. How do you see hypertension control fitting into that broader goal?
Right. Um, if people saw on Tuesday, President Trump at the White House proclaimed May of 2026 as National Physical Fitness and Sports Month, and he brought back the presidential fitness test. And so, those of us who might be a little wiser, a little more senior on this call, might remember being 10 years old and trying to do pull-ups at school to get a patch that said President's Fit. I passed the President's Fitness test. Somehow it went away, but we're bringing that back as a focus on physical fitness across the country. And of course, Secretary Kennedy at Health and Human Services has the Eat Real Food initiative and the revised dietary guidelines for Americans. And it's just another recognition of the role that food and exercise play in people's health. And these are the kinds of things that have a real impact on people's health, and they can address hypertension along with other chronic diseases, again, without having to simply rely on the clinical visit between the patient and the physician.
All right. Well, that's exciting. I think somewhere in my basement in a scrapbook, I have one of those President's Council on Physical Fitness and Sports certificates. So glad to see that coming back. And why, I think you may have already said this in other words, but is there a way to boil this down to why getting hypertension control right is so pivotal, so central to improving our nation's health?
Absolutely. Well, the simple fact that so many people have hypertension and that I believe the control of hypertension is doable as a national goal. Those two things alone, I think, set up the playing field for us to address hypertension as a chronic disease. Um, the message that I would have is that it's doable, but we need to do it right. And the way to do it right is what has been discussed thanks to National Forum. That is not only making sure that the clinician and the patient have the right environment to do their medical care, but also that communities create the right environment to make people healthy. And so the message would be that nutrition and physical activity are central to the health of Americans, just like the availability of medical care is. People shouldn't have to go out of their way to get low sodium foods or to get fruits and vegetables. They shouldn't have to go out of their way to get a diet that makes sense for them. They shouldn't have to go out of their way to be able to exercise in their own neighborhood. Uh, it, I think everyone will agree if someone were to say access to a physician is critical to controlling high blood pressure, nobody would disagree with that. But people wouldn't feel the same if somebody said, having gym class, bringing gym class back to your county schools are important, or fixing the sidewalks in your city is important, or bringing a decent grocery store to your neighborhood. Those can also address high blood pressure. It's just not a natural thing that the average person thinks of, I don't think. Being a public health physician, it's important to me to address all these things. One of the speakers earlier said, don't forget the social determinants of health. And that is so true. As a public health physician, these are the things that I think people don't recognize or even forget about when they think about building the systems that can help control hypertension.
Yes, absolutely. And all those social determinants or vital conditions for health and well-being are things that the National Forum, through our Move with the Mayor initiative, works with local leaders, local policymakers to address by implementing evidence-based policies, programs, and infrastructure changes from the community guide.
That's right. Those are the magic words to me, the community guide. Yeah,
It's gold standard science, huh?
that's right. Science that's applicable at the population level.
Yes, absolutely. So, Deputy Surgeon General Jung, really appreciate you joining us today and participating in the entire convening. That is great. We really value your commitment. What is the one message or call to action that you would like all of us who are participating today to take with them? What should we do differently after today?
So, number one, I would say the first thing is to keep doing what you're doing. Keep going. The work that you're engaged in, absolutely, it's essential to reducing hypertension. But I would say number two, double down on the partnerships. Dr. Weaver, the pharmacist, I believe she was the one that said hypertension is a team sport. 100% agree. We started this discussion with the idea that this is not an issue that's simply solved by clinicians and their patients in the doctor's office. The Surgeon General's call to action makes a big point in saying that it's an economic issue, it's a community issue, and we need to ensure that places where people live, learn, work, and play support hypertension control. That can only happen when we have partnerships and everyone agrees that this is something that we all have to work on.
Wow, that was so well said. Absolutely. We need to have places that are healthful and make it easy for people to make healthy choices where, as you just said, where they live, learn, earn, pray, play, and I'd add where they shop.
Yes, yes.